KGMU has set a precedent for all medical colleges in India. Here's how. Hello everyone, welcome to Straight Up by EdexLive. I'm Sharda Dasa, and today let's discuss the historic win for KGMU resident doctors as all the demands of the resident doctors were accepted. For years, resident doctors at the King George Medical University, KGMU in Lucknow, have been working tirelessly to save lives, often putting their own well-being on the back burner. With cramped hostel rooms, unavailable mess facilities, and transport and security concerns, doctors have endured discomfort for very long. But now, for KGMU doctors, things are about to change. After persistent advocacy and negotiation, KGMU has approved a comprehensive set of measures to improve the lives of its resident doctors during a Vice Chancellor-led meeting. Starting soon, doctors will receive their salaries from day one, ensuring they're not left waiting for their duties. The university is also providing housing rent allowance or single rooms so that every doctor can have the space they need to recover and recharge after long and tireless hours of work. But that's not all. The hostels are getting a complete makeover with 24/7 mess availability. No more worrying about finding a meal after a late shift. The university is also introducing regular police checks and inspections for mess staff so that the food is not just available but safe and reliable too. Family health coverage is another major win. Doctors will now be able to include their families in their health plans, which is especially important for those in their 30s and 40s who may have parents or dependents with chronic illnesses. This kind of support can make a huge difference in the lives of those who care for others every day. This is a historic moment for KGMU. But it's also an example for all other medical colleges across the country. The reality is, this problem isn't unique just to KGMU. Across India, doctors in government hospitals are overworked, underpaid, and often forced to work in conditions that are far from ideal. Doctor welfare is directly linked to patient safety. When doctors are well rested and supported, patients receive better care, says Dr Divyansh Singh, President of RDA KGMU and National Vice President of Federation of All India Medical Association. He claims that hostels should be air-conditioned because if residents are staying after hectic 36 to 48-hour duties, they must be able to relax. He also highlights that food availability and security are a major problem in medical colleges nationwide. Dr. Divyansh urges all medical students and doctors to voice their concerns. According to him, it's the only way their issues can be addressed, providing them a supportive atmosphere to fulfill their fundamental role as medical practitioners, that is, caring for patients. Now let's hear more about this from him. Over to you, sir.
RGR medical tragedy happened, so Supreme Court directed with a number of points and directions to all the medical institutes across India. These instructions were for the safety of medical doctors, for their proper resting conditions and for their proper health so that they can properly treat patients. Now we have to understand resident doctors are the backbone of healthcare of India. A healthy resident doctor translates to a healthy patient. So when we were demanding for all these things over the time, many of the other medical institutes and the resident doctors, they gave up asking for these demands, while we continued asking because we were understanding this point that the primary work of resident is to treat, and he is not able to treat if he is not well rested and he is not in sane state of his mind. So we continued demanding these things, including basic hygienic conditions to live. KGMU being the one of the premier institutes in India, it sets a benchmark and it paves a way for other medical institutes also.
रेजिडेंट ट्रेनिंग और टीचिंग के उसके ड्यूरेशन में है, इस दौरान उनको पूरा ऑप्टिमम एटमॉस्फेयर, सराउंडिंग, सेफ्टी, सिक्योरिटी, वर्किंग प्लेस सब कुछ बिल्कुल ऐसा होना चाहिए कि वो बिल्कुल सेफ साउंड अपने को फील करें और उनको कोई और चिंता किसी तरह का ना हो, केवल अपने काम पे ध्यान दें.
Thank you, sir. The implementation of these changes is set to begin on June 10th with formal orders from the Vice Chancellor, Professor Sonia Nityanand, already on the way. This proactive approach of the university's leadership is a positive sign for future of medical education and healthcare in India. That's all for today. Stay tuned to EdexLive for more interesting updates. This is Sharda Dasa signing off.